What is drug addiction? Addiction is defined as a chronic relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It is considered a neurological disorder because it involves functional changes to brain circuits involved in reward, stress, and self-control. And those changes may last a long time after a person has stopped taking drugs. Why study drug use and addiction? Effective drug education is important because young people are faced with many influences to use both licit and illicit drugs. Education can play a counterbalancing role in shaping a normative culture of safety, moderation, and informed decision making. Now let's watch Liwanag, the winner and best short film entry in the Department of Health Camarines Sword Treatment and Rehabilitation Center Second Short Film Festival at Avenue Plaza Hotel, Naga City.
Haligi ng tahanan, taong masasandigan sa mga panahong kailangan ng lakas, kalinga, at pagmamahal. Tanging lalaking hindi ka iiwan, ngunit nang mawala ng ulirat, nagbago ang lahat. Ang saya-saya namin noon. Pero, hindi ko inakalang ito na pala ang huling pagkakataon.
Lintik! Wala na naman ulam! Kamuting kahoy na naman! Ano to? Papakain mo saan kamuting kahoy?
Bakit?
Kahit aso! Hindi kakain nito! Ako! Kapapakainin mo ulit yan! Araw-araw kamuting kahoy!
Paano? Wala ka naman trabaho. Anong may bibigay mo sa akin pambili ng kanin? Di kamuting kahoy, pagsagaan natin yan!
Lintik! Ito kakainin mo to? Kakainin mo?
Tingnan mo! Nagising na yung anak ko! Yan! Maghanap ka ng trabaho!
May mga bagay na hindi kailanman may intindihan ng isang inosenteng tulad ko. Lagi siyang wala. Puro sila sigawan. Normal ba yun?
ni asa ako.
Anong nangyari sa'yo? Ganito na lang ba tayo? Ganito na lang ba ang buhay natin? Kala ko ba maghanap ka ng trabaho? Asan na yung trabaho? Saan ka na naman pumunta? Ang problema kasi sa'yo, ang tamad-tamad mo!
Ang ingay mo!
Ah! Ah! Nananakit ka! Ganyan? Ganyan na tayo? Ano ba? Ah! Hindi na ikaw yung asawa ko!
Hayop ka! Hayop ka! Asawa ko. Pinatay ko ang asawa ko.
Nay, Nay.
Wala akong maintindihan, wala akong maramdaman sa mga pangyayaring aking nasaksihan.
Number 1, nawawala pa siya. Bring the meds.
Sa kabila ng madilim na nakalipas, ay natutunan kong tanggapin ang lahat ng pangyayari. Sa halip na balikan ang nakaraan, napagpasyahan kong gumawa ng mga bagay na makakabuti para sa akin. Sa halip na sumabay sa makamundong sistema, ay pinili kong humakbang patungo sa landas na ikagagaan ng aking kalooban.
Ayaw kong di ako sasabi niyan. Ha?
Napabilang ako sa mga gawain kapaki-pakinabang sa ating lipunan at malaki ang pasasalamat ko sa Panginoon dahil sa mga pangyayaring ito ay natutunan kong tanggapin ang landas patungo sa liwanag. Ang kapayapaan ay magsisimula sa atin.
People take drugs to feel good. Drugs can produce intense feelings of pleasure. This initial euphoria is followed by other effects which differ with the different type of drugs used. For example, with stimulants such as cocaine, the high is followed by feelings of power, self-confidence, and increased energy. In contrast, the euphoria caused by opioids such as heroin is followed by feelings of relaxation and satisfaction. They also want to feel better. Some people who suffer from social anxiety, stress, and depression start using drugs to try to feel less anxious. Stress can play a major role in starting and continuing drug use, as well as relapse in patients recovering from addiction. They also want to do better. Some people feel pressure to improve their focus in school or at work, or their abilities in sports. This can play a role in trying or continuing to use drugs such as prescription stimulants or cocaine. People also take drugs because of their curiosity and social pressure. In this respect, teens are particularly at risk because peer pressure can be very strong. Adolescence is a developmental period during which the presence of risk factors, such as peers who use drugs, may lead to substance use. Biological factors that can affect a person's risk of addiction include their genes, stage of development, and even gender or ethnicity. Scientists estimate that genes, including the effects of environmental factors, have on a person's genes expression called epigenetics, account for between 40 and 60% of a person's risk of addiction. Also, teens and people with mental disorders are at greater risk of drug use and addiction than others. Environmental factors are those related to the family, school, and neighborhood. The home environment, especially during childhood, is a very important factor. Parents or older family members who use drugs or misuse alcohol or who break the law can increase children's risk of future drugs problems. Friends and other peers can have an increasingly strong influence during the teen years. Teens who use drugs can sway even those without risk factor to try drugs for the first time. Struggling in school or having poor social skill can put a child at further risk for using or becoming addicted to drugs. Although taking drugs at any age can lead to addiction, research shows that the earlier people begin to use drugs, the more likely they are to develop serious problems. This may be due to the harmful effect that drugs can have on the developing brain. It also may result from a mix of early social and biological risk factors, including lack of a stable home or family, exposure to physical or sexual abuse, genes, or mental illness. Still, the fact remains that early use is a strong indicator of problems ahead, including addiction. Smoking a drug or injecting it into a vein increases its addictive potential. Both smoke and injected drugs enter the brain within few seconds, producing a powerful rush of pleasure. However, this intense high can fade within a few minutes. Scientists believe this powerful contrast drives some people to repeatedly use drugs to recapture the fleeting pleasurable state. Here are some common signs of drug use: changes in attendance in school or work, abrupt changes in overall attitude, irritable, discourteous, aggressive, usually untrustworthy and lacks self-confidence, low frustration tolerance, lacking interest in one's studies or work, blames everybody but oneself, prefers to stay with peers, may frequent odd places, poor physical appearance, wearing of sunglasses at inappropriate times, unusual effort to cover arms to hide needle marks, stealing items which can be readily sold, unusual borrowing of money from relatives and friends, and association with known drug abuser. Consequences of drug addiction. People with addiction often have one or more associated health issues, which could include lung or heart diseases, stroke, cancer, or mental health conditions. Imaging scans, chest x-rays, and blood tests can show the damaging effects of long-term drug use throughout the body. For example, it is now well known that tobacco smoke can cause many cancers. Methamphetamine can cause severe dental problems, known as meth mouth, and that opioids can lead to overdose and death. In addition, some drugs such as inhalants may damage or destroy nerve cells, either in the brain or the peripheral nervous system. Drug use can also increase the risk of contracting infections. HIV and hepatitis C can occur from sharing injection equipment or from unsafe practices such as condomless sex. Infection of the heart and its bulbs and skin infection can occur after exposure to bacteria by injection drug use. Does drug use cause other mental disorders or vice versa? Drug use and other mental disorders often coexist. In some cases, mental disorders such as anxiety, depression, or schizophrenia may come before addiction. In other cases, drug use may trigger or worsen those mental health conditions, particularly in people with specific vulnerabilities. Some people with disorders like anxiety or depression may use drugs in an attempt to alleviate psychiatric symptoms. This may exacerbate their mental disorder in the long run, as well as increase the risk of developing addiction. Treatment for all conditions should happen concurrently. Remember that addiction and HIV or AIDS are intertwined health conditions.